All right, well, I want to welcome everyone here today to our CPHA UNAC Day of Advocacy, and our very great privilege to be announcing an amazing bill that I believe, and we all believe, is going to save healthcare in the state of California. You might think that's an overstatement, but it's not. This bill, SB 966, is going to protect patient access, patient choice. This bill is going to further equity, and these are important principles of healthcare in our state. So I'm very pleased to be here with all the 100 pharmacists who's traveled across the state to support this effort during the Advocacy Day. And with that, I'd like to turn it over to a representative from the Chronic Care Coalition, Alex.
Thank you. Good morning. Alex Kahn on behalf of the California Chronic Care Coalition. Very grateful to be here, grateful to Senator Wiener for carrying what we believe is the most important legislation for patients this year, Senate Bill 966, and grateful to President Emeritus for being here in support this morning. From a patient perspective, PBMs have morphed from a minor player to a major player in the healthcare scene. And we believe that this bill recognizes that they have a place, but it also recognizes that we need equity and we need a level playing field. So we know that this will be a major step forward to addressing cost, to improving quality and access, and we're grateful to be part of the sponsored coalition.
Well, it's my pleasure today to introduce both the Pro Tem Emeritus Tony Acton, who was our Friend of Pharmacy winner just last year for amazing support for the profession and for patients in California. And also my great honor to introduce Senator Scott Wiener, our warrior, our champion, the author of SB 966. Welcome, Senator Wiener.
Thank you so much, and I really want to just to the pharmacists, first of all, thank you for helping us all stay healthy and providing such a critical service. And I'm just so glad that over the years we've been able to do a lot of good work to make sure that pharmacists are able to practice to the full extent of your training and to be able to provide really critical healthcare services at a neighborhood level. And so in particular, the work you did with us around PrEP access, really, it means the world, so thank you. And I'm really honored to be partnering with you again this year on Senate Bill 966 so that we do, frankly, what even some red states have been doing, which is to have just basic, common sense consumer protections with respect to pharmacy benefit managers. This issue, while it will be controversial this year in the legislature, it should not be. There is bipartisan support in Congress to start reining in the PBMs and have consumer protections and stop this nonsense of the PBMs jacking up the cost of pharmaceuticals. We have just broad support for this idea. And it just makes no sense that you have these entities that were created as sort of just to administer pharmaceutical benefits for health plans decades ago, and they've grown and taken on a life of their own where they are so huge. Only a few of them control about like 90% of the market. They often own their own pharmacies, and they force people to go only to their pharmacies, not to their neighborhood pharmacies. They're merging with health plans as well. And then we have really anti-consumer practices like paying or getting paid one amount by the health plan for drugs, and then charging the pharmacists more than they're getting paid one amount and charging a different amount to the pharmacist and pocketing the difference, or getting rebates from drug manufacturers and then pocketing those rebates instead of passing them on, so it's a cost savings to consumers and to the system. And of course, because they're getting paid via rebates, they have an incentive to push these formularies for the most expensive drugs instead of what we need to be doing, which is to go to lower cost drugs and generics. But those don't lead to profit for the PBMs, and so we see a push towards higher cost drugs. And so these are just basic problems in the system. They're driving up the cost of drugs, they're driving up the cost of the healthcare system, and we need to have these consumer protections. We need to have basic oversight and regulation, and that's what SB 966 is about. And so I'm so grateful for the collaboration. This is going to be a fight, but if I have to go into a fight, going in with the pharmacist is a good thing. So thank you.
Thank you so much. I know we're a from the senator and also from the pro tem, but we have to at least, I think, do a short chant now, which is PBM reform now. So say it with me. PBM reform now. PBM reform now. PBM reform now.